As we age, our bodies undergo countless transformations, some visible, others hidden deep within. One subtle but impactful change many seniors experience is an unexpected shift in body odor. It's not often talked about, but this issue can quietly affect a senior's self-esteem, social interactions, and even how others perceive them. Many older adults report feeling embarrassed or anxious about an unexplained unpleasant smell, even though they bathe regularly, wear clean clothes, and maintain personal hygiene routines. So why does this happen? The answer lies deep within the biology of aging, and it's far more complex than most people realize. One of the most significant but lesser-known contributors to odor in seniors is a compound called 2-nonenal. As people age, particularly after the age of 50, the skin begins to produce this unsaturated aldehyde in higher quantities. A 2001 study published in the Journal of Investigative Dermatology by Hayes et al. Confirmed that 2-nonenal is responsible for the characteristic odor associated with aging skin. This compound forms through the oxidation of omega-7 fatty acids present on the skin's surface, especially as the skin's antioxidant defenses weaken with age. Nonenal has a distinctive greasy, grassy odor that can linger on clothes and bedding, even with frequent washing. Unlike the typical body odor caused by sweating or bacterial buildup, 2-nonenal clings stubbornly and resists removal with conventional soaps and deodorants. It's a natural part of aging, but few people know it exists, let alone how to address it. Beyond 2-nonenal, other internal factors contribute to changes in body smell in older adults. The liver and kidneys, two of the body's primary detoxification organs, may start to lose efficiency with age. A review published in Geriatrics and Gerontology International 2012 highlights that renal function declines gradually over time, even in healthy seniors, affecting toxin clearance. Even if blood tests appear normal, these organs might not filter waste and toxins as effectively as they once did. When waste accumulates in the body, it can be excreted through the skin, resulting in a sour or musty odor. In some cases, this is an early warning sign of declining organ function, even before more obvious symptoms appear. Diet plays an equally critical role in how the body smells. Many seniors consume diets that are high in processed foods, red meat, or low in fiber, which can lead to poor gut health and excessive fermentation in the digestive tract. Research from the American Journal of Clinical Nutrition, 2010, confirms that fiber intake directly influences gut bacteria balance and metabolic byproducts, including odor-causing compounds. Gut health deteriorates naturally with age due to reduced production of digestive enzymes and hydrochloric acid. As the gut flora shifts and becomes imbalanced, harmful bacteria may proliferate, producing sulfuric or ammonia-like compounds that escape through pores. This internal odor is far more stubborn than traditional body odor and cannot be masked with perfumes or soaps. Medications are another major factor. Many seniors take multiple prescriptions, some of which can affect the body's natural smell. A study in Clinical Interventions in Aging, 2014, noted that polypharmacy in older adults is associated with altered metabolism and increased risk of drug interactions, many of which affect liver and kidney function. For instance, certain antihypertensives, antidepressants, and cholesterol-lowering drugs may alter how the liver processes chemicals or how the kidneys eliminate waste. Diuretics can dehydrate the body, concentrating waste products and intensifying odor. Even common medications like antibiotics can kill off beneficial gut bacteria, tipping the balance in favor of odor-causing microbes. In some cases, the odor may resemble chemicals, sweat, or even a metallic smell, depending on the medication's impact on metabolism. Poor hydration is a silent contributor. Seniors often drink less water due to reduced thirst sensitivity, difficulty accessing fluids, or concerns about frequent urination. But without adequate water intake, the body cannot flush toxins efficiently. A 2015 study in Age and Aging highlighted that dehydration is common among older adults and is linked to impaired renal function and metabolic waste accumulation. Dehydration concentrates sweat, increases the presence of urea and ammonia in the body, and worsens odor. Urine may smell stronger, skin may become dry and more prone to buildup of bacteria, and the breath may take on a foul odor. A well-hydrated body simply smells better because it flushes out waste smoothly and consistently. Hygiene practices must also evolve with age. Skin becomes thinner, drier, and more sensitive, requiring gentler but more targeted cleansing. Traditional soaps may strip away natural oils without removing the oxidized compounds. Like 2-nonenal, a Japanese study published in the Journal of Cosmetic Dermatology found that persimmon extract neutralizes 2-nonenal more effectively than regular soap and may be better suited for aging skin. Seniors should be encouraged to bathe at least once every 2 days using these gentle but effective cleansers, and to focus on areas where skin folds and moisture accumulate, such as underarms, feet, groin, and behind the ears. Laundry hygiene is equally vital. Clothes and bedding can absorb and retain odor compounds that re-release over time. Seniors should wash clothing in hot water when possible and use odor-neutralizing laundry additives. Bedding, towels, and undergarments should be changed frequently, ideally every 2-3 days. Additionally, homes should be well ventilated. A stagnant indoor air can trap and recirculate odors, exacerbating the problem. A study from the Indoor Air Journal, ICE, found that poor indoor air quality significantly affects how odors linger and influence comfort and perception in older adults. Let's pause for a moment. If this video is helping you understand something you or a loved one is dealing with, take a second to hit the like button. Your support helps us continue producing more helpful, health-focused content. And if you've experienced this issue, share your story in the comments. Your words might help someone else feel less alone. Returning to the root of the issue, it's important to consider metabolic disorders that become more common with age. Diabetes, for example, can lead to changes in body odor due to the presence of ketones in the bloodstream. Research published in Diabetes, Care 2011, shows that ketone bodies can cause fruity smelling, breath in people with uncontrolled blood sugar. This can signal a serious condition called ketoacidosis. Others may experience increased sweat production or fungal infections, which can cause odor. Similarly, thyroid issues can disrupt the body's temperature regulation and sweat patterns, leading to new or intensified odors. A 2014 study in the Journal of Clinical Endocrinology and Metabolism confirms that both hyperthyroidism and hypothyroidism affect thermoregulation and perspiration patterns. Certain foods can help cleanse the body from within and reduce odor naturally. Chlorophyll-rich vegetables like parsley, spinach, and wheatgrass can bind to odor-causing compounds and assist in detoxification. A classic study from the Journal of the American Dietetic Association 1980 demonstrated that chlorophyll in supplements helped reduce fecal and body odor in elderly nursing home patients. Fruits like pineapple and citrus promote hydration and help balance pH levels in the body. Fiber-rich foods support gut health by feeding beneficial bacteria and sweeping away waste. Probiotics, whether from yogurt, kefir, or supplements, can help restore balance in the gut microbiome and reduce gas and odor from within. A 2013 meta-analysis published in Nutrition in Clinical Practice confirmed that probiotics reduce intestinal gas and body odor in adults. It's also worth considering stress. Chronic stress affects hormone levels, especially cortisol, and can lead to excessive sweating, particularly in the underarms, palms, and feet. This sweat, when combined with skin bacteria, can produce stronger odors. Additionally, stress impairs digestion and weakens the immune system, further contributing to odor problems. According to a 2012 study in psychoneuroendocrinology, stress significantly alters sweat composition and may increase the production of sulfur-based odor molecules. Incorporating stress-reducing practices such as daily walks, gentle stretching, mindfulness, and quality sleep can indirectly help manage unwanted body smells by restoring hormonal balance and improving overall health. Ultimately, the key to eliminating senior odor lies in understanding the body's changing internal landscape and addressing it holistically. It's not just about masking the smell, it's about fixing the root causes. Seniors who drink enough water, eat a clean diet, support their gut and organ health, and use the right hygiene tools will naturally smell better, feel better, and regain confidence in social situations. This isn't vanity, it's dignity. If you've made it this far in the video, we want to hear from you. Have you or someone you care for struggled with unexplained body odor in older age? What solutions worked for you? Leave a comment below to start a conversation. Your input could change someone's life. And before you go, make sure to like this video, subscribe to the channel, and turn on the notification bell so you never miss our health tips for seniors. Share this video with someone you care about, because aging should never mean embarrassment. It should mean wisdom, strength, and living with confidence.